so for those of you that don't know me, if there's anybody here, I'm Dr. Guma, and I'm a rheumatologist, obviously. And what we're going to talk about tonight is we're going to talk about gouty arthritis, talk about the approach to gouty arthritis, how to diagnose it, how to treat it, and I'm going to introduce you to a brand new drug, the first gout drug in like 40 years to come out. So my goals for tonight, for you guys, are one, to teach you guys the right approach to gout and to teach you how to manage it. And you know, we all sit there and we say, oh, I know how to manage gout. I got that question right on the boards last week or last month. But the reality is, and you guys see this in the hospital, a lot of people don't know how to manage gout. And trust me, in primary care, there's a lot of people that mismanage it. So really what I want to do tonight is I want to go over the disease, talk about the important points, and I want to talk about this new drug and kind of familiarize you guys with the new drug. Now, a couple of little housekeeping things before we start. This is a paid pharmaceutical dinner. Takeda Pharmaceuticals paid for your dinner, and they sponsored me to come up and talk. Okay. Having said that, I also speak for Abbott, and I speak sometimes for Pfizer. I don't do a lot of speaking anymore because I have a problem with some of the spin, in my own opinion, on some of the drugs that are out there. But if I feel really strongly about a drug, and I feel really strongly about getting a message across, I'll do it, and I'm here. All right, so that's one of the reasons why. You guys know the way we do it, the way I like to lecture is I like it to be interactive. So, I mean, especially you guys, it's not a huge group. There's not a lot of intimidation here. If you have a question, ask it, anytime. And normally I don't like to hear people's anecdotes and people's stories about their life experiences when giving a lecture because it drags the lecture down. You know what? This is a good time to do it because this is a group where we can really learn a lot if somebody has a question about an experience. Sometimes a story, when you have the time, a story is better and a better way to put a point across to someone who's learning than a slide with a graphic on it. Okay? So let's start. Let's talk about gout. Let's see if I do this right. And this is not my slide kit. So I have to get used to the slide kit. It's the first time I'm using it. You know, normally I have my own gout slides, but when you do pharmaceutical talks, you use what you get. All right, so we know that we see gout all the time. We know gout as the classic, prototypic, inflammatory, acute, episodic, intermittent type of arthritis. And some people, unfortunately, think about gout that way. So some docs, all they think about gout is when that foot swells, that's when I treat the gout. They don't think about it as a chronic disease. And that's one of the things we have to get the point across, that it's really a chronic disease with a lot of other problems. It's a progressive disease. It gets worse and worse. And if you don't treat the uric acid, then you're going to get more and more problems. You really have to think about that right there. Almost like we think about RA in certain ways, you have to think it's not an acute, intermittent process only. And it requires a plan. Not only do you have to treat the acute episodes with your little indomethacin or whatever, but you have to treat it chronically. And so many docs avoid this and miss this. And here's the key. You're going to see this time and time again for every one of you guys. This is the magic number where you want the serum uric acid to be, less than 6. And that should be your goal, less than 6. We'll talk about why in a minute. What else we know about gout is that it's the most common cause of inflammatory arthritis in men over the age of 40. You know, most common cause of arthritis is OA. There's probably 30 million Americans with OA. There's probably 2 million Americans with RA. And in men over 40, gout is the most common type of inflammatory arthritis. And they think about 5.1 million adults over the age of 20 that has gout in the U.S. It's also going up in women. You know, women are protected from gout while they're fertile, while they have estrogen there, and then when they hit menopause, then they start getting gout more commonly, but it never really gets to the point that men have it. And it usually lags behind a couple years. You don't see a 40-year-old woman with gout. You don't really even see an early 50s with gout commonly. But a little bit after that, they start getting it. Unless, of course, there's a secondary reason, like if they like to drink. We all make uric acid every day. We know that. It's a byproduct of cell metabolism. So what do? We make it, we get rid of it. We excrete it. We get rid of it in the urine, we get rid of it in the stool. As we get older and we lose the ability to get rid of uric acid, the levels will begin to climb. It's a magic number for you. When the uric acid levels hit 6.8 in the serum, then they start to precipitate out. So when it gets above 6.8, you start to deposit uric acid crystals in other parts of your body. Renal stones, tophi, joint involvement. At 6.8, that is not a high number. That's when it starts to precipitate out. And we know if you get it less than 6, you can pull it back in. And that's why 6 is the magic number. So above that low number, and for some guys, this is appropriately treating gout. For some guys, they're like, oh, you know, I got it in the 6s, I got it at 7, I'm okay. Not right, not good. We know when you have those uric acid levels high, something triggers them and you wind up with an acute flare, right? So something triggers the gouty flare to happen. What is it that triggers a gout? Well, we can look at a couple of things. One, we know that local acidosis in the tissue will trigger it. 2, trauma, right? Somebody twists their ankle and they get gouty arthritis, they may get an attack in that ankle. Alcohol binges. You guys all know the classic story about alcohol binges. Just look at your patient population in Newark. But it also happens in guys, you know, in their 40s and 30s and 50s. They go on a golf weekend with their friends. And, you know, they're used to drinking a couple of beers on the weekend. They go golfing with their buddies. And they're golfing and drinking and golfing and drinking and peeing and golfing and drinking. And the uric acid levels go high. They get dehydrated. What happens? You get a gout attack. And also, here's the key, guys, it's important in this slide. What else can trigger a gout attack? Initiation of urate lowering therapy. Any sudden rise in the uric acid level is going to trigger it. Any sudden drop in the uric acid level is going to trigger it. Why does it drop to it? Tommy, go ahead.
Hey, it's a good question. Well, hypochlorothiazide, a common drug like that that's used. How common do you see gout attacks from hypochlorothiazide?
Okay. You can see gout attacks from any diuretic. And some people will tell you that the aldosterone antagonists don't do what they do, and you get it from dehydration. So hypochlorothiazide, not being a super potent diuretic, is given to you less commonly than a thiazide. Not a thiazide, a loop diuretic like furosemide. So you can see them. You can definitely see them, sure. The initiation of uric acid lowering therapy can give you a gout attack. You guys know why? Anybody know how it happens? How does it happen that if I start somebody on allopurinol, they can suddenly get a gout attack?
Because of the quick decrease in the...
Right, the quick decrease, what they think it does, they think it pulls the uric acid crystals and the urate out of the tissue. And by pulling it out of the tissue, it suddenly comes into the joint and into the serum, and that may help trigger an attack. So it's actually the mobilization of that may trigger the gout attack. So that's why when you start somebody in allopurinol, or you start somebody in a drug like Euloric, what should you always give them when you're starting them? A medicine to prevent the attack, like colchicine or prednisone if you need to, or even an NSAID one. So let's look at the stages of gout. We've got a couple of stages, and this is important too. Asymptomatic hyperuricemia, which does not necessarily mean you're going to get gout. Acute flares, time in between, and advanced gout. Asymptomatic hyperuricemia. It doesn't mean you're going to get gout, but if you have gout, you have this period before you get it. And it includes the elevated serum urate, not having history of gout before, and no clinical manifestations of gouty arthritis. Some of these people are going to develop acute gouty arthritis, some are not. So it doesn't mean that you're going to get it. How do you treat asymptomatic hyperuricemia? Anybody know? Is there a drug that you use for it? Asymptomatic hyperuricemia, you don't treat it exactly. And that's a mistake a lot of guys make. A lot of docs will treat it with a drug that lowers uric acid and they trigger an attack, and drugs have side effects. And you don't really need to risk that if you have asymptomatic hyperuricemia. Yes?
If you have a patient who is previously symptomatic with hyperuricemia, after an acute gout, after an acute attack, you still have hyperuricemia, but at that point they're not symptomatic, you still try to bring them down since they were more conscious.
The rule of thumb in treating gout, when you're looking at uric acid levels, if they've had more than 2 attacks within a year, or they have evidence of end-organ disease, then you should start lowering the uric acid level. So if it's your first attack and you're 35 years old, and your uric acid level after that attack is 7, it's not necessarily a push to lower that with medication. You can try dietary modifications and everything else first. They have a second attack, or they start getting tophi or chronic hyperuricemic end organ damage or showing it, then you want to treat them. Then you want to treat them. The acute flare, you guys know this. This is so painful. It's acute, it's rapid, it happens at night. You go to bed, you're fine, you wake up in the morning, your foot is swollen. Very, very painful. When you're laying in bed, you have gout on the foot, the sheets of the bed touching your toes enough to make you squirm in pain.